Hey, it's Clay, CPAP My Way, CPAPMyWay.com. Today I'm here to discuss the clinical or provider menu in the AirSense 11. As always on these particular videos, I've got to say, if you're not a clinician, under the supervision of a clinician, or you have no idea what you're doing, stay away from this menu. You can definitely mess some things up. So take that for what it is. In the menu here, there's going to be options for settings, modes, different options that are related to your therapy. So if you don't know what you're looking at, it's really a good idea not to mess with them. As always, if you like the info, we really appreciate the thumbs up. For more info, subscribe. We kind of keep these videos coming. And then comment with any questions or concerns below or things that you might like expanded on. I'll be happy to do everything I can to answer those. So let's jump right in. All right, so this is our clinical therapy menu. Instructional. So to access the clinical menu, it's really simple. You just press and hold both of these two icons at the same time. So my options and my sleep review, you put your fingers on both of them and hold them until the screen changes. Now you will see clinical home up top, settings, sleep view, and exit. The only thing we're going to look at here is settings, right? This particular machine is an auto CPAP, so it can go in CPAP, auto set, or auto set for her. That's the algorithm specifically designed for the ladies. For instructional purposes, we'll leave it in auto set mode. Hit OK. This is where you put in your pressure range. So your minimum pressure, you want it to be typically 4, 5, 6. And then you're going to select max pressure after that. We'll put that as 20. Hit OK. Now we get a pressure range from 5 to 20. Auto response, standard or soft. This is going to give a little bit more of a gradual feel if you put it in soft. Standard is what most people run it at. Ramp time is turned off. This is also available in the patient level menu, so you could set this to whatever you want. Most people are going to put that in auto, especially for a first-time user. All right, starting pressure is going to be the minimal pressure. You could do anything lower than your initial therapy pressure, right? But if you're in auto 4 to 20, you're only going to be able to start it at 4. So EPR, right? Turn that on or off. This is where you'll tell where the EPR should be run. Most people are going to leave that in full-time mode so that the patient can have it when they want it, right? Humidity levels also available in the patient level menu, so there's not a whole lot of reason to address that. Mask setting is also available in the patient level menu, but pillows full face if you're giving them a full face mask, obviously throw that on there. Tube type, slim or standard. If you're going with the standard slimline from ResMed, leave it as slimline. If you're giving them a 22 millimeter old school tube, change it to standard. Next is the BV filter. That's the bacteria filter. So if you're using an inline bacteria filter, I'll show a quick image of that. If you're using one of those, you will want to turn that on. 99% of the time, that's going to be left off. This is where you can give the patient the access to the more advanced menu. So this is a quick view of what it looks like simple. This is a quick view of what it looks like advanced. Most of the time, I feel like it's a good idea to just give them the full advanced menu so that they can look at all the information right there on their home screen. Smart Start, Smart Stop, both of those are available in the patient level menu as well. The care check-in, that's just obviously the integrations that allow the machine to send notifications to the patient. Reminders, you can set the patient to be reminded for mask, tube, or filters. Obviously your language, time zone, temperatures in Fahrenheit and Celsius. You can restore your default settings or erase all data. If it's a rental and it's coming back from somebody else, you will want to erase all data before you give it to a new patient. And of course you get the about, and this just tells you all about the device usage hours and things like that. Once you've made your settings, hit back and then exit, right? And you'll be back to the patient level menu. Pretty simple deal. ResMed makes it really easy, and so there's not a whole lot extra to it. Real simple menu navigation.